Balance is like learning a new language. This is something I've started to say more and more often. And as much as I've studied balance over the last 7-8 years, the more I believe that. It is absolutely very similar to learning a new language. If you were to learn a new word to a new language, maybe Spanish, maybe Italian, maybe French, if I learned a new word once a month, once a week, how would I expect to become fluent in that particular language? Well, balance is the same way. If you only work on your balance once a week, once a month, how can you truly expect yourself to improve? You're not going to. All right? So, some top 10 fall statistics, and I know we've ran through these a number of times, but it's always good to have a refresher. 67% of falls don't happen from a height, right? They don't happen from being on a ladder. 67%, right? 67% of these falls happen when individuals slip or they trip, right? Going up a curb, walking upstairs, maybe turn around and something is left on the floor, water, maybe it's a piece of clothing and you slip on it. That's quite a bit. So the prevalence of falls in seniors is 700,000 to 1 million hospitals patients yearly. 700,000 to 1 million hospital patients per year. Let it be noted, remember that stat, it has been reported that nearly 40% of all nursing home admissions are in some way related to a fall. All right? And I know you guys, it's important to stay independent, and a lot of the folks that I work with want to live their lives out at home. I certainly do, at least that's how I feel now. It may change, I don't know. But now when it comes to hospital admissions, all right, let's look at costs, right? Since we're throwing out all kind of money just to keep you in the loop, there was a package in this latest bill. The Build Back Better bill, okay? This is not political at all. But there was package in there to help pay home caregivers, in-home health care workers, hospital workers. Those establishments, your continuing care retirement centers, your CCRCs, are in trouble. We have a severe lack of workers. My daughter just graduated nursing school, right? She is already working overtime on a floor in a department she shouldn't be on to begin with. They hired her on. The hospital created an internship program, a mentorship program, because they can't find experienced nurses to run in that cardiac unit. How about that? So when I say we need to practice our balance, I'm not telling you this to try to scare you. These are the facts, all right? So when we look at falls, this I know off the top of my head. In 2016, right, 8 years ago, and remember, 10,000 Americans are turning 65 every day, we had over $50 billion attributed to fall-related injuries. Medicare and Medicaid bore 2/3 of those costs. $29 billion is paid by Medicare. $12 billion is paid by private or out-of-pocket payers, right? Those that do not have insurance, or all those guys that come from Canada and have operations here, right? So we see that a lot in the hospitals. And you have $9 billion is paid by Medicaid, right? Now, as the number of Americans 65 and older grows, we can expect the number of fall injuries and the cost to treat these injuries to soar, i.e. 10,000 Americans turn 65 every day. So what kind of costs are we talking about here in Florida? Well, when it talks about total costs, it's about $3.9 billion annually here in Florida. All right, and this is a heavily populated area. It's a popular retirement destination. Medicare, $3.9 billion. Medicare pays $3 billion. So think about these social health care programs, right, that we're using. Something is going to need to be done in order to keep funding this, right? But we can do our part. Let's see. Let's go to another. Okay, let's talk about New York, another heavily populated area. $3.3 billion in New York is attributed to fall-related injuries, right? Medicare, $1.9 billion. You have Medicaid that's paying $947 million, right? So between Medicare and between Medicaid, we're talking at close to $3 billion right there. $3 billion out of a $3.3 billion total that these programs are paying. So this is costing us a lot of money, right? And we need to do our part and stay upright. So one of these things I wanted to talk about today, obviously, is the cost, but the hospital readmissions. So what I found was a study that was talking about fall-related injuries and readmissions. And a lot of times people who fall, they're twice as likely to fall again within the year, right? Now, if you have a neurological impairment, right, we're talking Parkinson's, dementia, Alzheimer's, you're going to make up a good majority of those readmissions. So if you know someone that has one of these neurological disorders, you're already armed with knowledge, knowing what the expectation is or what to anticipate, all right? Again, guys, you can check these notes. All these sources are available at mybalanceuniversity.com. You can go find them yourself. Fall-related injuries are a major reason why seniors are readmitted to the hospital within a month after being discharged. Little is known about the relationship between falls and hospital readmissions. We hadn't even studied this stuff. We have all these statistics and we hadn't even studied it. So last thing I'm going to leave you with, right, is a quote by one of the researchers here. And what they found was falls are a trifecta in terms of reasons why they need an increased focus. All right, and this is from a researcher who's a member of the Institute for Healthcare Policy and Innovation. They are highly prevalent, cause a lot of damage, including death, and they are preventable. However, fall prevention is being left out of the discharge planning conversation, and that needs to change. I just did a lecture here maybe a couple of weeks ago that was talking about how little doctors are talking about falls when people come to the office. Right? Now, this might not be the case for you guys, but if you're going to your doctor and they're not talking to you about falls, or you're bringing your parents to your doctor and they're not bringing it up and your parents are 65 and older, then maybe you ought to start asking the questions about the falls, okay? You're armed with plenty of information here. So, all right, let's go ahead and get started. Let me clear my space off here. Lots of good stuff. I don't know if you guys have, you guys are in pretty good shape, but you may know the CDC has a program. The acronym is STEADY, right? That's the acronym, STEADI. And I forget, it's Stop Something Elderly Accidents, Deaths, and Injuries. I forget what the T stood for. But what they have here, if you'll go to the CDC and you'll type in STEADI, right, the acronym STEADY, you'll have access to some really awesome checklists. So I have a lot of these on my website, mybalanceuniversity.com, right? And so what this is this helps you go through different things in your house. It has checklists for, are you at risk for falls? This is stuff that a doctor should use. Now, I know that's impossible to read, but I'm just going to hold you up and kind of give you an idea of what that looks like. So, but really, really cool stuff. They have a lot of information and tools there. So just more information for you guys.